Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Okay, well, this has been a wild morning, and now we have another wild guy here with us. You heard him before. His name is Mike Respol, and he is actually, he's in charge of the dental division there at AGI Medical and Dental. Good morning.
Good morning.
And Mike is very special. He's so enthusiastic, and I guess I wanted to start off, Mike, by asking you a question. Why are people, I've never been afraid of dentists. Why are people afraid of dentists?
There's really about 2 to 3 reasons. Time, pain, and money. Those are the 3 big reasons. Yeah. Time, pain, and money. That's what I'll talk about today a little bit, but that's the beauty with AGI right now. We're very friendly, family-oriented, so it's not your typical stone cold office where you walk into, somebody opens up a glass window, you sign in, and they call you. I mean, that's how my doctors are when I go. So that's not how it is at Dr. Mencia's office. It's just we have different ways to now cut that time back. Pain is always an issue, of course, when you hear dentistry, and money. But I've said in the past here on the show, money should not ever be an option. There's always financing available. There's ways to work it out. No one should walk in pain. No one should look bad. We have people walk in just yesterday, 46-year-old male, never been to the dentist before, never.
Really?
Yesterday in Boynton was his first time in the office.
What made him come in?
He's got loose teeth.
Well, that's a good thing.
First time.
As the teeth are coming out, go see a dentist,
no,
right?
he didn't have that much work really to do, but he... very nice guy, and he was so happy when he left. He's coming back. He has to get a couple of crowns and a deep cleaning, but he was very happy when he came in. We spread the word. It was his first time. He was scared, so we were able to make him telling jokes, and he was laughing. By the end of when he left my consultation room, he was laughing, and he had a great time. You know, that's the great part about it.
You know, it's funny. I've always had my whole family has had problems with teeth, so. When I was much younger, really young, I guess I just got married, I really took a lot of time with them. And you're right. I lived in Miami, and I went to a dentist who he would let me come in on Saturday mornings because that way, you know, he could put me on a finance plan. He used to sing opera to me.
Oh, really?
So I've always enjoyed dentists because there is something about having, not only is it healthy to have good teeth and a good mouth, but you know how many people talk to you and they put their hands up on their mouth, and that's because they're afraid to smile, right?
Exactly. That's only part of it. I said in the past, too, whatever goes in the mouth goes throughout the body. If you have infections in the teeth, that is constantly going throughout the body. Abscesses, people don't realize this. Everything they eat stays in the mouth, in the teeth. If you don't brush or floss, that bacteria gets worse and worse, and it goes throughout the body. Some people feel run down. Some people are sick. These infections relate to a lot of sicknesses, a lot. It's not just a healthy smile. It's a healthy living. Actually, February, ironically, was National Dental Health Month in February. So I wanted to talk a little bit about that. People don't realize how important keeping the mouth clean as to the rest of your body. If you go to a cardiologist and they tell you you need this, this, and this, you do it right away without even thinking about it. Or your eyes, your ears. But for some reason, no one goes to the dentist and thinks, okay, I don't have any pain, I'm fine. But what we see typically is unbelievable. You know?
But I know that you and Dr. Mencia say that you should definitely have checkups every 6 months.
6 months minimum. As we get older, we cut those down. Most people come 3 to 4 months for periodontal cleanings. You know, as we get older, the bone recedes. You need a little bit more attention. So younger people, 6 months is fine, but that's the minimum. But 3 to 4 months as we get older, that's the way you should do it.
there's so many things I'm going to talk to you about this morning, so I don't want to lose time. But before we do that, because I want to talk about the CAD-CAM system and all that, but I want to talk about you personally. I know you're celebrating 5 years with Dr. Mencia's
Right.
and
This past Monday.
Dr. Rosemary and Dr. Andy Mencia with the AGI Medical and Dental. When I first when I first came on board with working with Dr. Mencia, I we didn't have medical and dental. It was just medical.
Oh, right.
And even though you did some dental work, but now you have
Oh,
just
it's
because of you, and I do attribute a lot of this to you. You've had wonderful dentists, but you're a really very smart, caring businessman, and you've taken on the dental world to make sure, as you said, that all his patients they come in for medical, they wind up, getting their mouth checked too. So, but for you to stay with the company over 5 years, it's got to be a nice company, and you've been in this business a
absolutely.
long time.
Long time.
What has your experiences been in this whole
Well,
world?
with Dr. Rosemary and Dr. Andy, one thing that they are is caring. That's another reason people don't go to the dentist. The dentist is stone cold. They're very caring people, and this is why I love being with them. They give me the opportunity to care about people, to spend time with them. It's not always about the money. It's about caring for people. You know Dr. Rosemary. You know her personally.
Oh, I
She
love her
cares a lot about her
very
patients,
much.
and this is why I've been with them. They give you that opportunity to. I was at a company for many, many years, and I left because we lost that feeling of care for a patient. It did become more of a business than it did about caring about a patient. With Dr. Andy and Dr. Rosemary, they do care about their patients, and that's the opportunity they give me. I call them at home. They have my cell phone. I mean, it's just anybody who comes into our office, our family. We really do. I know them all by name. Boynton, we just opened a little over a year ago. We have 868 patients. I know
You're
just about.
kidding.
No, that's what we're up to right now.
Wow.
And I probably know most of them by first name. It's just it's a caring facility. And like you just said with Dr. Andy, if you're a medical patient of Dr. Andy's in Boynton or down in Fort Lauderdale, all his patients are entitled to a complimentary consultation. And you don't see that anywhere. I mean, again, it brings it up about cost. If you go to a dentist, it's going to cost you $200 to $300 to walk in the door. All of Dr. Andy's patients get a complimentary consultation. It doesn't hurt. It doesn't cost you anything. It goes in, see what you need, and we are caring, and that's the beauty of the
That's
whole
what's
business.
really, because days are 24 hours a day, and there's a lot that can happen in that time. And we work probably 12 of those hours. People like you and I are
Oh, yeah.
very,
It doesn't end.
we work a lot. And so if you're not with something that you really appreciate and that people appreciate you, see, that's the other thing. Here, Dr. Mencia, by the way, Dr. Mencia is out today. I think he's in Orlando. He's at a speech. And so he said, "Why don't you bring Mike on for the show?" I said, "I'd love that."
He's great.
Because Mike,
He's great.
Mike, we keep him in the background too much. But he loves to talk about
No,
what he does.
He's great. I just love the whole aspect of
Yeah, I
dentistry.
know. So now let's talk about you. One thing that I like about what you do too, you're always open for the latest and the greatest.
Right.
So is the latest and the greatest the CAD-CAM system?
The CAD/CAM system, what that stands for is computer-aided design and computer-aided manufacturing. The technology's been around for quite some time, but as anything else, like a cell phone, anything, it gets better and better and better. We have the latest technology right now. It's actually the brand name is E4D, and what that does is we're able to design and manufacture a crown. This is how it happens. If you go in for a crown, typically, just say one crown. The doctor prepares the tooth. They take an impression. They make it temporary. They send it to a laboratory. It takes about 2 weeks, 10 working days to 2 weeks.
If there are no holidays involved.
Right. Then you come back and you get your crown cemented in. What this technology does, we're able to design and manufacture it in the office so we can get it back within a day or two, which down in Florida, we know we have a lot of tourists, a lot of cruise ships, snowbirds. So what this enables, and we just had this situation where people were down for 4 months, They don't get back to their dentist in New York, so we're able to make this crown. I'll call their dentist in New York, and they'll say, no, send me the x-ray. I'll email them the x-ray, and they'll say, no, Mike, go ahead. Tell the doctor, go right ahead, make the crown. He can't wait the 4 months to come back. So we're able to design. How this works is when we have the patient in the chair, Dr. Rosemary, again, would prepare her tooth like we do any other crown, but then the technician would come in and they will scan. There's a wand. They will scan that area instead of taking an impression. They scan it. It goes to a laptop that we have. Then what the technician does is she designs it. She'll make the contacts. She picks the color, designs it on a laptop, a three-dimensional picture, and then she would send it to the milling center that we have in the office.
And so that also means things will be more perfect.
Oh yeah, it's perfect. Everyone Wanda, who's doing the main manufacturing, she just did her 51st, and we just got this up and running December 24th. We had it delivered on Christmas Eve, so she just milled her 51st crown, which is unbelievable. I mean, and every one of them go in perfectly, and that's the best thing. Time. You can come in if you're on a cruise, you're just visiting. We're trying to get this word out that we can do this job instead of waiting 2 weeks, and you can go on your way within a couple of days. That's the beauty.
And talk about crowns. Really, what happens if someone can't have a crown? They pull the tooth?
It all depends, of course, on the diagnosis. A crown is usually made when there's a loss of tooth structure. You bite down on something, break the tooth, where filling is no longer available. You have to cover it with a porcelain crown. And that's what it is. It's a protection crown. Sometimes it's more than that. If it needs a root canal, then all root canal teeth need crowns because they get very brittle. And that's basically what a crown is. It's a jacket that would go right over the tooth, a protective jacket. Okay,
and it's made from what, porcelain?
Porcelain. We have special blocks. They're called zirconia blocks. Now, some teeth have to still go to a lab for special treatment, but these blocks that go into the milling center, of course, zirconia, they're hard as a rock. I mean, they're not going to break.
So, in other words, so some people can have a whole mouthful of crowns.
Sure. We get them all the time.
So now I'm going to jump you into something else. What's the difference of the implants?
Implant crowns, this machine is able to do that. We're not at that level yet, but implant crowns are different. They are made differently through a lab. Some are screw retained, some are cemented. So we have a lot of patients, especially in Boynton, from up north. They're used to having implants done in Manhattan 30 years ago, 40 years ago. So our main thing is to find out what that system is. There's a million different implants now from the past. So we find out what that system is, and then we can go ahead and make implant crown. But it is a different type of crown. It just can't be seated on there. There's different parts involved, and we have to find out what that system is, and that's the big change in crowns.
So how long then have you actually been in the dental world? What, 20 years?
20.
I mean, why did you choose this? How did you wind up there?
Oh, my goodness. When I went into the...
He's very young and cute, actually. He thinks I'm making him old, but I'm not.
Oh, my goodness. When I went into the Navy, 1973. That's what I chose. I was a medic and a dental technician. 1973, I was 17 years old, and from that point on, that's what I've done all my life. I didn't know that. That's what I've done all my life. I was in sales, repair. I built dental chairs. I've managed this is my 29th year of managing from New York to here. But this is what I've done all my life.
But dentistry is so different today.
Oh,
why don't you take us back there when you were 17, you went in the service?
We didn't even sterilize instruments back then. I mean, it was a dry clave, they call it. Nothing went into steam. You wore gloves, not masks. It was so different. I remember when I was 9 years old in Queens, New York, my dentist was smoking in the office. I remember it.
Right,
and that's one of the reasons. Right? I wrote a story about it when I was in school, in elementary school. I'll never forget the smell. I know his name. I'm not going to say his name, but I remember him leaning over me with smoke and a cigarette coming out of his mouth. I'll never forget it. And just the smell today, all these years later, and I was 9 years old. And then after the procedure, we all had these silver fillings. After the procedure, go out in the waiting room, and there's all the mothers smoking in the waiting room. I'll never forget it as long as I live. But it's just one of the reasons. This sounds crazy, but I'm the only one in my family with teeth, with good teeth, because since I was young, since I went in the military, I had all my stuff done, and I live by that. Hey, you know how a smile is. You have beautiful teeth.
Yeah, I know, but I want to ask you a question. So now you decided that dentistry is something really important to you. So you were a little kid, and then you went on, and then what's the the chairs? Explain what's different.
Everything is different. The procedures, when I was a dental technician in the service, we had to develop our own X-rays. You go in there, the old dipping methods, like you would take a photo, the old dipping. You take this big giant X-ray, you have to go into the dark room, you come back 15 minutes later to show the doctor, and these things are soaking wet. You put them in a dryer, and then they diagnose. Now, as you know, if you've been upstairs, everything is digital. I take an X-ray in a second. There's no radiation involved anymore, and I can send that X-ray all over the world. Anyone who has an email address, I could send you an X-ray. I've done it. There's a man in Fort Lauderdale a couple of years ago. I sent his X-ray to Taiwan once because he was living in Taiwan. I can send it anywhere. That's the biggest difference. Digital. Everything is digital these days. The chairs. Do you remember like these hand pieces with the pulleys?
Oh yeah! Oh my gosh!
That's a big thing. Now everything is.
You get into this lovely chair, but the other big thing is the sleep. I know you do a lot of that. Yeah. That when someone's going to have some major work, you put them to sleep.
Yes, that's a big part of it. Apprehension, or maybe an elderly patient that can't open, gaggers. But we do a lot of that. We can get multiple procedures done in one visit. Somebody who needs a lot of work, instead of keep coming back, keep getting them numb and keep coming back and back, Dr. Rosemary can knock out practically the entire mouth in one visit, and maybe just come back and have your crowns delivered. But she does multiple procedures in one sitting. That's the beauty of that, Well,
and it's very important when we talk about that there needs to be a anesthesiologist available. And of course, with Dr. Mencia as the having a medical practitioner there, it's very important.
Dr. Andy
don't be casual about this,
no,
people.
Dr. Andy will monitor everything. He comes up. Ted, who we have, the nurse anesthetist, he's been doing this, oh my goodness, about 40 years, probably more than that. He monitors the heart. Everybody is there watching. There's nothing to be afraid of. And like I said, Dr. Andy would come up. If anything should ever go wrong with any procedure, we have the medical facility right there. And that's one of the things, too. Now, speaking of that, we have a lot of people, elderly patients on Coumadin, a lot of blood thinners and stuff. So typically in the past, what you had to do is get a clearance from their doctor. You fax something over to them. Hopefully somebody gets back to you within the same decade. But now what it is, Dr. Mencia's people would take an INR, come upstairs to the dental room, prick the finger, and test it right there on the spot. If everything's okay, you don't have to stop the Coumadin for 5 days and then start your procedure. We can get it done right there on the spot. That's the beauty of having a medical dental office.
And something that you said, which I think is really important. Let me just tell everybody again, this is Mike Respol, who, of course, is your official... your manager of AGI Medical and Dental.
Boynton
is that
Beach,
in Boynton Beach?
Yeah,
okay.
Manager, yeah.
And let me give you a phone number. If you're sitting there thinking, okay, I guess it's about time I do something about my teeth, and I like Mike, and I want to go sit and talk to him, you can reach him at 561-270-6494. That's 270-6494. And their office in Boynton Beach is really in a very interesting location. It's surrounded by beautiful communities, family communities, and it's on Hagen Ranch Road in Boynton Beach. But the way that I would get there, of course, is I would take Boynton Beach Boulevard and go up to Hagen Ranch Road and then just go south
South, right in
right?
the
South
public
to
shopping
yeah,
center right
exactly. It's very easy to find, and it's gorgeous. It's they took over a place which was very I mean, it was brand new. There was nothing in it, and
there.
you kind of designed everything, and it's elegant, just
Oh,
gorgeous.
it's picking up that area too. Now we have a gym opening up Monday.
Oh, next door, is that what's going to
Next
be
door,
there?
Turbo Gym.
Oh, that's good.
They have a nice clientele.
Oh,
We have a
very
few
good.
other shops opening up this month also. So it's a beautiful area.
And the thing, though, that I think that you said, and I think is really important, I hate to go to an office, and neither one of your medical centers have it, where there's all that glass, and you have to knock on the glass, and it says, don't knock, first of all, and then you wait there, no one comes. Everything is open, and that's what I love about the centers.
No, it's very,
It's
very
open and
that I
friendly,
can
and that's what it
guarantee.
means.
I go to doctors all the time, a dermatologist, cardiologist, and they treat me. I've been going there for so many years. Just recently, I go to a dermatologist, and I got this nasty letter a couple of months ago. I've been going to this same dermatologist for 15 years. I got this nasty letter just 2 months ago, and it says, to avoid collection proceedings, this needs to be paid immediately. I've been going to this guy for 15 years. The balance on the bill was $6.34, and they give me this big yellow sticker on it.
You're
So
kidding.
last week I had to go. Well, actually, in February I went back on my birthday
can't
for my
believe it.
treatments, and I talked to the doctor. And he says, "Oh, we outsourced that. I'm sorry, but you should really know your patients. I mean, come on. Now, the time before that, I had a $35 credit. So I don't know. Now they tell me, they're going to go to collections for $6. So, but you need to know your patients, and we do treat them like family. Like I said, I know them all by name and who paid what. So it's
I'm
very
glad
friendly.
you bring that up, because I have a bookkeeper who comes in once a week, and she doesn't really know anything about our business in a sense. She thinks she does. And I never let her send any invoice
Without
out
looking
until
at it,
I've
yeah.
looked at that invoice. Because there are things I know she doesn't, or I thank people, or I something, because that is really the worst part.
It is, especially if you have a long time patient. I mean, come on.
I mean,
you got to
that's,
know who they
I
are.
mean, $6, even if it were $100, but $6.
Yeah.
You're right. You always touch on all the things that I agree. That's why I love having you here, because you're really, you are such you're the heart of that business, and I know that. I mean, it's been wonderful. I didn't know you had all those new those patients. That's really exciting.
Yeah. It's building quite a bit. Word of mouth too. I mean, marketing is one thing, but most of our patients are from the local area. Just word
And
of
you're
mouth.
but you also are going down. Are you open? You're open on Saturdays now,
Yes.
also
Yes.
up there in Boynton Beach, as
Yes.
well as down in
Yes.
in Fort
So
Lauderdale.
we'll always be available. There's a call service that they'll get me, and then I can reach Dr. Rosemary, and she'll come in. That's what I'll do today. I'll go up there and see. We have emergency visits, but we're always ready to accommodate someone, no matter what.
That's so different.
Dr. Rosemary was there till 10:30 last Friday night. She was at a class in Miami Thursday and Friday, an implant class. She's studying. Then we had an emergency. She came in from Miami and worked till 10:30 at night, just extracting a couple of teeth.
No
So,
kidding.
I mean, again, try to find a dentist on a Friday. Never mind on a Saturday or Sunday.
No, you're absolutely right, Mike. I know that's why you love being there, and it's why I love working with all of you. I have such respect, and I just love that you take care of people that way, and they know that. As a matter of fact, I should tell everybody now that Dr. Mencia, of course, will be one of our speakers at Cure, as well as Nicole, who's the dietitian. She and we're going to do some cooking and some superfoods right there as hers. We're going to have a lot of fun, so we hope that you're going to come too, Mike, to see what
I read about
we're
it.
cooking up.
Yeah, I was reading about it
We're
yesterday.
cooking up, right? But so for people who really would like to go to what we think is it's not just a best dentist. It's the dentist that cares, with all the experience and where there's a medical component. So please be sure to call 561-270-6494. And we really thank you so much for coming. And Mike,
Yeah.
you're going down to Fort Lauderdale now?
Right now. And I want to say one shout out to my friend Eddie, who's also a patient I seen last night. He's coming in. I told him it's the first time he's listening to the show. Hi, Eddie. See you later.
Okay, Eddie. Thanks. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.